Here is a detailed explanation of the Total Triiodothyronine T3 test, covering all 15 sections extensively. 1. Introduction. Total Triiodothyronine T3 is a diagnostic blood test used to assess the levels of triiodothyronine, one of the two major hormones produced by the thyroid gland. This hormone plays a significant role in the body's metabolism, temperature regulation, and overall energy levels. The Total T3 test is an essential component of thyroid function testing and is frequently used alongside TSH and T4 tests to evaluate thyroid health. DEFR 2. Definition. The Total T3 test measures the combined concentration of free, biologically active, and bound, protein-bound and inactive triiodothyronine in the bloodstream. T3 is more metabolically active than thyroxine, T4, but is present in smaller quantities. It provides critical information on how the thyroid is functioning and helps detect various thyroid disorders. NASHA 3. Indications. This test is indicated when a person shows signs of hyperthyroidism, excess thyroid hormone. There is low or abnormal TSH or T4 levels. The patient is being treated for a thyroid disorder, and the response to therapy must be monitored. Symptoms like unexplained weight loss, increased heart rate, tremors, irritability, or goiter are present. T3 toxicosis is suspected, elevated T3 with normal T4 and suppressed TSH. U4, used for diagnosing hyperthyroidism or T3 toxicosis, monitoring thyroid replacement therapy, evaluating the severity of thyroid dysfunction, differentiating between various thyroid disorders, assisting in the assessment of euthyroid 6 syndrome, normal TSH but low T3. 5. Why do need of this test? You may need this test if you have symptoms of a thyroid disorder, e.g. fatigue, heat intolerance, weight changes. You have abnormal TSH or free T4 levels and your doctor wants more information. Your doctor suspects hyperthyroidism despite normal T4 levels. You are receiving treatment for thyroid disease, and hormone levels need to be monitored. Number 6. What happens during the test? A phlebotomist draws a blood sample from a vein, usually from your arm. The procedure takes less than 5 minutes. The sample is then sent to a lab where immunoassay techniques are used to measure the total amount of T3. There is no pain, just a small needle prick. Number 7. How long for my results? Turnaround time. Typically 1 to 3 business days, depending on the lab. In emergency settings, some labs can deliver results within a few hours. 8. Prepare for this test. Fasting. Usually not required unless combined with other tests. Medications. Inform your doctor if you take thyroid medications, steroids, estrogens, or birth control pills. These can affect the results. Supplements. Biotin, vitamin B7 can interfere with thyroid tests. Avoid taking it for at least 48 hours before testing. No special preparations are needed otherwise. 9. Risk 2. The risks are minimal and similar to any standard blood draw. Pain or bruising at the puncture site. Dizziness or fainting, rare. Infection at the site, very rare. Hematoma, blood accumulation under the skin. Normal values. Normal total T3 levels vary slightly between labs, but generally are age group, reference range, and yearbili. Adults, 80 to 200 nangram/ml. Children, may be slightly higher. Note, always interpret results based on the reference range provided by the testing laboratory. 11. Interpretation of results. T3 level. Possible interpretation. High. Hyperthyroidism, Graves' disease, T3 toxicosis, thyroiditis, overmedication with thyroid hormone, low, hypothyroidism, starvation or malnutrition, severe illness, euthyroid 6 syndrome, liver disease, use of certain drugs, e.g. propranolol steroids. Fact 12. Factors affecting results. Several internal and external factors can affect T3 levels. Medications, increased T3, birth control pills, estrogen, methadone, clofibrate, decreased T3, propranolol, steroids, amiodarone, lithium, carbamazepine. Physiological conditions, pregnancy, can elevate total T3, acute illness or surgery, may temporarily reduce T3, liver disease impairs protein binding affecting total T3. Nutritional status, malnutrition or fasting, may decrease T3. 13. Clinical significance. Elevated total T3 is a hallmark of hyperthyroidism and may even be elevated before T4 levels rise. T3 toxicosis, a form of hyperthyroidism where only T3 is elevated, is only detectable with this test. In euthyroid 6 syndrome, T3 levels drop due to illness without a true thyroid problem. Monitoring T3 can help assess the effectiveness of thyroid hormone replacement therapy. HADA 14, no more. Total T3 is influenced by thyroid-binding proteins, unlike free T3, which measures only unbound hormone. Free T3 tests are preferred in some clinical situations, e.g. protein abnormalities. The Total T3 test is part of a thyroid function test panel that includes TSH, free T4, and sometimes thyroid antibodies. The test is not diagnostic on its own and should be interpreted along with clinical symptoms and other thyroid function tests. TSH 15, conclusion. The Total Triiodothyronine T3 test is a valuable tool in evaluating thyroid function, particularly in diagnosing and managing hyperthyroidism and T3-dominant thyroid disorders. While useful, its interpretation must consider clinical context, medications, and other thyroid parameters like TSH and free T4. Understanding your T3 levels can help guide treatment decisions and improve outcomes in patients with thyroid-related health concerns. Thank you. Have a nice day.